Protect yourself and those you love from COVID-19. Get vaccinated.
Here's what we know about the vaccines.
They're safe. Serious side effects are extremely rare.
They have one job. They kick your immune system into gear, then they leave your body.
They're effective. They provide outstanding protection against serious illness.
Listen to the local doctors you trust.
Let's strive for a 75% vaccination rate.
Do your part.
Reconsider.
Get the shot.
Families they leave behind.
Vaccinated tomorrow. That is from 8 a.m. to 1 p.m. tomorrow. And I also want to highlight for everyone that these are not taxpayer funds. These are American Rescue Plan funds that we received from the federal government. No local taxpayer dollars are being spent on this. This is again a $100 incentive trying to get our population more vaccinated, to get to 75%, to provide a greater level of strength and resilience to what we've been experiencing. We're also going to hear today, again, the picture of what is going on inside of our hospital, the number of people that are dying, the number of people that are passing away because we don't have an overall enough strength or immunity within this community, and it's happening day in, day out. And talk to your friends and family members, and just, there are a lot of people that are dying, and that's unfortunate, and it's sad, and it's horrible. And we have a proven tool that is very, very helpful in getting us stronger, healthier, and happier as a community, and that is the vaccine. So again, tomorrow from 8 a.m. to 1 p.m. behind the Civic Center, collaboration between Albany Area Primary Health Care, Phoebe, Putney, Dougherty County, and the Georgia Department of Public Health. Free vaccinations, and you will also receive, as long as you're eligible for the vaccination, a $100 prepaid Visa gift card. That is a huge incentive for folks to consider, and we ask that you please consider getting the vaccination. Thank you.
Thank you, Mr. Chairman, for your remarks today, and certainly we are very excited about tomorrow's event, and certainly again invite all of Dougherty County and Albany to come out and participate if it is your desire to be vaccinated. It is a great time to do it tomorrow. We will move now and hear from Dougherty County's coroner, Mr. Michael Fowler, for some remarks. Mr. Fowler?
Good morning. I have a very short presentation today. I got to leave and go to another funeral. I'm getting burnt out really going to funeral after funeral, so I got to leave and go to a funeral. But to count this week, the residents here in Dougherty County, we have 333 deaths in Dougherty County residents. I want to encourage you, consider Saturday, as the chairman have said already, vaccination. We know it worked, so I encourage you again. It's like one death after another. Last death week we had 326. We had one more death every day since, and now we got 333. Next week, you never know, it could be you. So I'm trying to say consider you and consider your loved one getting vaccinated. Thank you.
Thank you, Mr. Coroner, for your remarks today. We will now hear from our representative from Phoebe Putney Memorial Hospital. We have with us today the CEO of Phoebe Putney Memorial Hospital, Mr. Joe Austin, for some remarks.
Thanks, sir. Good to see everybody this morning. Thanks for allowing me the opportunity. I will tell you that we've got a bit of a positive trend going on right now in the fact that the numbers have come down some in the last couple of weeks, and we're very grateful for that. But we're still admitting patients every day. We still have sick patients in our hospital. Let me give you the numbers quickly, if you don't mind. First of all, COVID inpatients that we have today in our system, which includes Phoebe here in Albany, Phoebe Sumter, and Phoebe Worth. 133 patients in our healthcare system today. But the positive news is that's a 38% decrease over the past month. You may recall we peaked at 214 or 15 patients about a month ago. And also, we've had an 18% decrease this week. So those numbers are very, very positive from that standpoint. Today, for the numbers specifically, we have 101 patients here in Albany. We have 27 patients in Americus at our Sumter Hospital, and we have 5 patients at our Phoebe Worth Hospital today. Of all those patients, you've heard the physicians I've stood in front of you for a long time talk about the level of and intensity of the illness. And of those 133 patients we have today, 47 of those are in ICUs. So those are very ill patients. We have 39 of those on ventilators today, unfortunately. And the number that always grips all of us, in the past week we had 13 deaths. And our heart and our condolences go out to all those family members that have lost loved ones in the past week. The average age of the patients, of the 820 we've admitted just in the last 2 months, the average age is 56, and you recall that is down substantially, and I know the physicians have told you that average age started out around 65 during the initial surge. It's down substantially based on the fact that our community, the older generation, did a very, very good job of getting vaccinated, so the average age is definitely down, so it's 56 the average age. 57% of those patients are under the age of 60. 53% of the patients that 820, excuse me, are female, and 49% are African American, and 47%, excuse me, are white. Here's the issue, and we've said this time and time again. The vast majority of the patients in the hospital today, of those 133 patients, are unvaccinated. Probably 85+% of those in the hospital are unvaccinated now. And that's why I think what the chairman talked about a few minutes ago, the community-wide event tomorrow is so important. And I just cannot emphasize strongly enough how important it is for our community to continue to seek the vaccination. And, we all know what are the consequences of not getting vaccinated. Well, it's very likely you will get sick. It is very likely you will pass that virus to somebody else. And it's and if it's severe enough, you could end up in a hospital in our community, and then absolute worst case scenario, if people pass away. As you heard me say, we had 13 patients pass away last week, so we have to continue to get vaccinated. So let me add on with the chairman, please access the community-wide event tomorrow. I mean, it's going to be very seamless. It's going to be talk to Mr. Sam Allen a few minutes before the meeting. And it's set up to be very easy to get through and get in and out and get your vaccine tomorrow. So please avail yourself of that. One thing I will mention also, another reason we need to get vaccinated. I don't know if you've been watching the national media, but in the past week, the past month, almost 25% of the new cases in this country have been pediatric cases. You may recall the first wave, and Dr. Ruiz will be up here in a few minutes. He can talk more specifically about this. But the first wave did not affect our children as badly as this one is doing now. And it's really impacting our children. And I would just tell you, this is Joe Austin's personal comment. And if you don't want to get vaccinated for yourself, please get vaccinated for your children. Please get vaccinated for your grandchildren, because you can take it and you can give it to one of your children. None of us want that. The pediatric hospitals around this country are filling with children right now, COVID positive children. And I think we need to all pay very, very close attention to that. Now, switching gears just quickly, I thank you to you in the community. A number of you have asked me, as I see around the community, what can we do for your workforce? What can we do to support those, we call them the healthcare heroes? And so many people have done so many remarkable things. And we've had prayer groups that have been outside our hospital in the past week or so. And that prayer is such a powerful tool, and we so appreciate that. We've had people bring meals for our staff, which we're so grateful for. We've had, yesterday there was a group at change of shift time, a large group from Carroll Academy. A lot of the students came out with drinks and snacks and signs, basically saying, thank you for what you're doing. And then that was huge. I mean, I just cannot tell you what that does for morale of our team, because they are tired. It's been 18 months or so that we've been in this battle, and the staff are tired because the COVID positive patients keep coming. And why do they keep coming? It's because we're not getting vaccinated the way we should. I mean, I just cannot emphasize enough how clearly we need to get that. So if you really honestly want to support those folks that are on the front line taking care of our loved ones, my mom and dad and brothers and sisters and all yours, please get vaccinated. I mean, that's the number one way you can help our staff, is go find a vaccine, because it's available every place. A lot of places down have the vaccine. And I will tell you, you can call Phoebe. There's a number we put out. I hope you write this down, 312-MYMD, MYMD. The number is actually 6963, 312-6963. All you've got to do is call that number, and we'll get you scheduled for a vaccine. You just call us, and we'll get you in absolutely as soon as we can. There is another issue going on in the country right now. It's called, we've heard us talk about the monoclonal infusion treatment that we're giving at the hospital. And it's given all around Georgia. There are 136 sites in Georgia actually giving the monoclonal infusion right now. And because this is a therapy for those that turn positive, that test positive for COVID, it's not a substitute for the vaccine. Please understand, it is not a substitute for the vaccine. People need to get vaccinated. But if they're vaccinated or unvaccinated and they turn positive, this is a very, very good treatment for them. The Department of Health and Human Services a week announced that they, in a similar fashion way they did when the vaccines first came out, they're going to take control of that, and they're going to start allocating that out to the various areas, to the various states. States have the opportunity, excuse me, to allocate that out to the various sites. And like I said, I think there are 136 sites providing this infusion treatment right now. We're blessed here at Phoebe. We still have a fairly adequate supply, and we can continue to give that. So let me tell you, if you test positive, someone in your family, someone you know of test positive, call that same number I just gave you, 312-MYMD, and get yourself scheduled for that. We will go through an online evaluation with you, and we'll get you scheduled and bring you down. And one thing I'll have to say also, remember the vaccine and this monoclonal infusion treatment, they're free. All you've got to do is call us, and we will make sure you get it. So don't let a cost concern be at all an issue for you. Just call us and let us give that to you. And I will give you one last word here. Anytime that we spiked like we did, and I think the screen was on up there a few minutes ago, we spiked to 214, and we're down to 133 a day. Generally, when we go to a spike and we start coming down, we don't get an immediate bounce back. We go into a little bit of lull, and then we'll come back up as we did last year from the July 4th surge to the holiday surge. And so there's a bit of optimism that the numbers will continue to slide down. But I say that to be positive, but I also say as a word of caution, we cannot let our guard down. And I know I'm repeating myself, but it's intentional. We need to get vaccinated. We need to go find the vaccine, and we need to do everything we can to make sure that those that we love and care for are vaccinated. If we can stop that next surge, we can stop the surge that some may expect to come in this holiday season if we'll vaccinate enough people in our community, in our country. So with that, I will conclude, Chief, and I'll thank you for your time so much.
Thank you, Mr. Austin, for being with us today. Mr. Austin, of course, serves as CEO of Phoebe Putney Memorial Hospital. He has been a constant presence in our COVID-19 task force and what we're trying to do throughout this community, and we appreciate you being here with us this morning. We'd like to move now and have an update from a representative from the Department of Public Health, the Director of the Southwest Georgia Health District, Dr. Charles Ruiz.
All right, I'm sorry. Good morning. We've already heard some very wise and appropriate messages this morning. I'm going to try not to be redundant, but I do have a few other things to share with you. Let's start with the new cases in Dougherty County. Over the past 14 days, there have been 984 new cases of COVID that have been reported to us. And that works out to about 70 new cases every day among Dougherty County residents. So even though numbers are getting a little bit better as far as new cases and hospital admissions, we are far from the end of this surge. 70 brand new cases every day in Dougherty County. That really adds up, and it illustrates the danger that surrounds us. And of course, there are some things that we can do to mitigate that danger that I'm going to get to very shortly. And one of those is vaccines. I'd like to give a report on how many folks have had vaccines in Dougherty County. Our records show that 47% of people who live in Dougherty County have had at least one vaccine. And I want you to bear in mind that this also includes the children. And children up to age 12 are not eligible yet. So if we were to subtract that group of the population, we'd see that well over 50% of the eligible people in Dougherty County have decided that these vaccines are at least worth a try. As of today, 41% of everyone who lives in Dougherty County is fully vaccinated. That's good, but there's room for improvement. And I'd like to sort of take my hat off to the folks in Terrell County. Terrell County is the highest vaccinated county in our Southwest Georgia Public Health District. 56% of people who live in Terrell County have had at least one vaccine shot, and 49% of those who live in Terrell County are fully vaccinated. So it can be done. We have people right here in our own neighborhood who are showing that we can get above that 50% mark. So vaccinations do work. They have saved many lives. They have helped many people to stay out of the hospital, and they have helped many people to simply avoid the infection altogether. We've never said that they're perfect, but they are very helpful. They are safe, and all you have to do is just look at the rates of people going into the hospital that have been vaccinated and look at the rates of those who are unvaccinated. And pretty much every hospital that you look at in the state of Georgia has the same story. The vast majority of people who are being admitted are those who are not vaccinated, and the same is true for those who are dying from COVID infections. We can also help ourselves by practicing social distancing whenever possible. And it is a balance. We're not locking ourselves down totally. Many of us have jobs to do. Many of us go to school and so forth. There are things that we need to do. We need to get on with life. But whenever we have an opportunity, we need to practice social distancing. When we cannot practice social distancing, wearing a mask will help us to avoid getting a COVID infection. And if we happen to have an infection, it will help to reduce the chance that we might spread it to other people. Keeping our hands clean, keeping hard surfaces disinfected are also steps that we can take to reduce the spread of COVID. Another thing that we can do is get tested, and we have a slide now that gives some information about the testing that public health offers here in Dougherty County. We currently have a testing site here in Albany. It is off of Palmyra Road. If you turn off Palmyra Road onto 13th Avenue, going northeast, you'll see that testing is going on there. It is free, and the hours right now are 9 a.m. to 6 p.m. So they're testing now. You can go now and get tested with or without pre-registration. I do want to stress the fact that we are changing our hours. In the recent days, the demand for testing has subsided a little bit, so we're pulling back just a little bit on our hours. Starting tomorrow, Saturday, the weekend hours will be 9 a.m. to 2 p.m. every Saturday and Sunday. And then this coming Monday, our new weekday hours will be 9 a.m. to 4 p.m. But they're there today until 6 p.m. You can pre-register, and if you do so, it will speed the process up. You're not actually making an appointment. You're just pre-registering so that the folks who do the test will know who you are and how to get in touch with you. And when you do that, you can still go anytime you want to when they're open. And subsequently, if you have to go back for another test down the road, your information will be saved. You can pre-register in a variety of ways, and one way, a very good way, is to use the QR code that you can see if you have access to our slide now. This code can be scanned with your smartphone. This code is on the front page of the Albany Herald. I'm not sure if it's 7 days a week. I think it's at least 5 days a week. It's on there. It's also on the website for Southwest Georgia Public Health. And it's also at the testing site. If you get there, if you have to wait in line just a little bit, the QRS code is there available on some signs. So that speeds the process up. You can also pre-register by calling a toll-free number 1-844 778-2455, I believe. I better put my, okay, I got it right. So we urge anyone who feels like they need to have a test to go get one. Well, one group of folks who need the test is people who have COVID symptoms. One of the problems that we see over and over again is people have symptoms that are consistent with COVID, and instead of staying home, they go to work, they go to school, they go out to social activities, and they spread the virus. So we want to kind of review those symptoms again that we've been talking about really for 1.5 years now, and we've got them kind of illustrated on the slide up here, and they haven't really changed in quite a while, but fevers, chills are symptoms consistent with COVID, coughing, shortness of breath or difficulty breathing, fatigue, muscle aches or body aches, headaches, a new loss of the sense of smell or taste. Having a sore throat is another COVID symptom. Nasal congestion or a runny nose, nausea or vomiting or diarrhea. Those could be due to other problems, but all of those are consistent with a COVID infection. So if people have those types of symptoms, we urge them to stay home, consult with your doctor, and it's okay to leave home to get a test, but otherwise stay home and isolate unless you and your physician can rule out the presence of COVID. And I would like to repeat the fact that the vaccines are available tomorrow morning at the Civic Center parking lot. The incentives are there, $100 for people who live in Dougherty County. It's easy to do, it's quick to do. It'll help protect you, it'll help save your life, it'll help also improve the health of your community. Thank you very much.
Thank you, Dr. Ruiz. We will now turn to the Director of the Dougherty County Emergency Medical Services Department, Mr. Sam Allen, to give us a report today from the front lines.
Good morning. Thank you, Chief. Again, from Dougherty County EMS, the virus is still in our community. We have to do everything that we can to help protect each other, ourselves, our children, our family. Please consult with your physician, get the facts, consider the vaccine. So let's look at the numbers. We are seeing a little bit of a slight decrease. Again, it's not a big decrease, but it is a slight decrease in the number of COVID positive patients that we are transporting to Phoebe. So we're looking at from January to September, and you can see we really spiked high. We've come down just a little bit, but is it enough? No. We need to do better. We're getting there, but let's all work together. So can we go to the next slide? The remote's not working. Okay. So on the next slide is more detail from August to September, and you can see the trend line is somewhat flat, but it's got a little bit of a lowering in it. So that's a good sign that we're doing better in our community. So please, let's keep up the good work. Let's get these numbers down. Let's get out there. If you think you have symptoms, consult with your physician immediately. Take every precaution that you can. Next slide, please. So at this point, I want to show you the number of positive cases that we've been transporting. We had hit a high of 15.45% 2 weeks ago. This past week was 11.07% of 911 EMS calls that are COVID positive related. So again, it's still in our community. Please don't let your guard down. Please do what you've got to do to protect yourself. Next slide, please. Okay, so on the vaccine information, the two primary, you have the Moderna and you have the Pfizer. The time frame that you get the shots, I'm really concerned and worried about. July hit us really hard this year compared to July of last year. I'm really concerned about what's coming up for Thanksgiving and Christmas when we get into January. We got hit really hard this past January. So as a precaution, I'm reaching out, asking everybody now to look at this. The time frame when you take your Moderna shot is approximately 6 weeks, and the Pfizer is 5 weeks by the time that you finally get fully vaccinated. So please make your decisions now. We have the mass vaccination site tomorrow. Please, it's a drive up, get your shot, drive off. I mean, it's going to be relatively very quick, very simple. Next slide, please. So the time frame, if you take the Pfizer and you start on next Monday, it would be October 13th when you would take your second shot. You would not be protected until somewhere around October 31st, theoretically, somewhere in that date range. If you take the Moderna and you take it on Monday, it would be the 18th before you would take your second shot, and then it would be about November 2nd before you would be at your highest point for the vaccine to be taking effect to give you as much protection. So please remember, there's a time frame involved in this. Don't delay. Next slide, please. We're 44 days away from Halloween. We're 69 days away from Thanksgiving. And if you consider 69 days minus 35 days, that's not a whole lot of days left in between to make your decisions. Same way with Moderna, you're looking at 42 days. So when you subtract that off of 69 days, again, your time frame is getting very short. Please talk to your doctors, make your decisions, get good informed information. Go to the CDC website, find the facts, make a good informed decision, and please highly consider the vaccine. We will be giving it out tomorrow, and I do want to remind everybody that's coming to the Civic Center, when you come down Oglethorpe, to turn on Front Street by the Veterans Amphitheater. As you go down, and you'll turn on West Mercer to enter the parking lot to start the process. So again, all traffic will be coming in off of Oglethorpe, turning on to South Front Street, going by the Veterans Amphitheater, and then you'll proceed down to West Mercer, where we start the parking lot process to get you going. We'll be there tomorrow. Please come out and get your vaccine. Thank you.
Thank you, Mr. Allen, for your report today. We'll pause now for any questions that may have came in. Okay. No questions today. We will remind you that we will be back here at 10 a.m. next Friday for our Friday press briefing. And certainly we hope to see you tomorrow between 8 and 1 in the back of the Civic Center. If you have not been vaccinated, we want you to be a part of the Strive for 75 campaign. It's very simple. Do your part, reconsider, and get the shot. So if you're so inclined, we'll see you tomorrow at the Civic Center. With that, that brings our press briefing to a close today. Thank you very much, and be safe, everyone.